As the world grapples with the coronavirus pandemic, lockdown measures challenge how development and humanitarian aid efforts best help at-risk populations. When COVID-19 hit, members from ICM, the Philippines, pivoted their work and created an online chatbot to help people assess their own health symptoms and disseminate key information from the country's Department of Health.
Here in the Philippines, we approximate that about 8 or 9% of all of the people live below the ultra-poverty line, and ultra-poverty is less than 50 cents US approximately per person per day. Our hope is that our programs give these households the pathway to progress out of poverty step by step. The core program that we offer to do this is called Transform. It's a community-based adult education program that we've designed over about 20 years. Because of the pandemic, one of the things that we needed to do very rapidly was to shift our data collection and communication tools. This chatbot that we developed assesses COVID-19 related symptoms, and it would then help people navigate the Philippine Department of Health's COVID algorithm, and then it links respondents to other sources of support. So for example, we were able to connect people to mental health chatbots and other resources like that.
So chatbot, it's really just simply a messenger system saying, except that you are building a logic to that response. You just think of when you have to go get your passport or get your driver's license. There's always a form that you normally have to fill out first, and then you have to submit it, and then you go to the next window, and then you pay. Maybe to you it looks really simple, but internally, maybe there's 20 different steps that the organization has to do to provide that service for you. So that's kind of the idea of a logic pathway is, okay, where do we want the user, the person who's engaging, what are we trying to help enable them to do? And we don't want them to get lost along the way.
The logic around COVID, especially in the first 4, 6, 8 weeks, was really tricky because I think the whole world was trying to figure out what is the right algorithm, who should stay home, who should go to the emergency room, who can be okay just seeing maybe a midwife or a nurse, and everything in between. This chatbot helped us navigate people through complexity using a platform that they're very, very familiar with.
One of the best things that we discovered is it wasn't super complicated. Actually, most of it was all designed by me and Lincoln, and neither of us are super technical. If you are an NGO with limited budget, I think that's one of the exciting things here too, is there are a lot of these different products out there that are either completely free or very low cost, but we decided to go forward with this third-party software called ChatBot. Only works with Facebook, so that is one of the limitations, but there are different softwares for different platforms. We had been hearing lots of feedback from our staff that the primary way they were engaging our networks was already Messenger. And so we figured that's the most natural way for us to get accessibility. Our primary partners are church pastors across the Philippines. I would say, around 50% may have a smartphone or smartphone access. We use kind of an automated texting service that was trying to replicate this to see would it be better. What we found is in the Philippines, because of the prepaid numbers, it's cheaper to replace your SIM card than to reload your card. Almost by the time you get a fresh number, it expires and isn't useful anymore. Whereas in Messenger, there's a little bit more of a consistency with it. And in the Philippines, Facebook has the free data option. If someone has access to a smartphone, then they can use our chatbot and not have to pay anything. We purposely designed it without any photos, and anything that requires the paid version, the user just had to touch a response. And so they never had to type. Sometimes there was even an I don't know. So if a medical term that they didn't know, they didn't feel stuck. We tried to make it as intuitive, as simple as possible, as if it was a normal conversation with a live person. When people were symptomatic, it would then send a message 24 hours later to say, hey, can we do the checkup with you again to see if you're feeling better today or not?
Trying to find a tool that could change quickly, but then it's on a platform that's familiar. I don't know if there's many other examples of something that people almost check every single day. This is the app that they go to, and people who don't have a smartphone have access to a Facebook account by either sharing a smartphone or their neighborhood internet cafe. It was this mixture of being able to customize the information, but then the users are going through something that isn't brand new. They don't have to get a new app. They don't have to sign up for a new account. They're not entering their address again. So that made it quite unique. And the other part was that it's hard work developing it, but if it works within just 10, 15 people who tested it, then we felt confident that there'll be no change if it's 10,000, 50,000, 100,000. It's the exact same algorithm.
The platform itself is very scalable, but there's still some of that we need to learn. Like, why didn't it go to serve all of Philippines? We maxed out at maybe 5,000 unique users. Many people used it almost as a emotional tool, like to not freak out.
At ICM, we have our own security protocols. The main focus is on what we call personally identifiable information, or PII. We generally store our data all on password-protected servers. Some of it is cloud-based, and then we restrict access using password-protected accounts. Only the analysts that are working on a specific project have access to PII. And for the large majority of the organization, and then what we disseminate would be summary statistics. So there's no way to identify who the individuals are.
I'd say the more complicated parts, especially as more was being known about COVID-19, sometimes the symptoms would change, and so we would have to go back. The other complicated part is our network operates in the central and southern part of the Philippines, so our dominant language there are Tagalog, Cebuano, and Ilonggo. We did those 3 plus English, and so that meant we had basically like 4 versions of the chatbot all within one interface. We decided very quickly that we could use the chatbots for our pastors network, which is called Thrive, and we also developed one for our savings group network called Prevail. There will be some adjustments that we have to make as an organization, but I do see these as part of our long-term solution now because they are so easy to use.
In a lot of our traditional programming, it takes us a lot of time to design something, and then when it comes to rollout, we only can manage a very small rollout. It takes maybe another, if we're quick, a couple weeks, but probably takes another few months to reiterate, redesign, try again. But for this case, because the technology is all built there, we were doing some of these iteration cycles in days instead of in months. And then it's interacting with our users in seconds as well.
We can see real time, did they make it all the way through or did they stop? Why did they stop? A lot of people stop there. Whereas, if you were in the field, you would have the person being trained who would execute the survey and then be like, this is a bit rough. Go back to the office and be like, how many people had a rough time? Okay, let's make some improvements. And so you can do, like 50 of those days within a few seconds. And by the end of the day, I think we had most people making it through.
Chatbots and other internet-based programs can help people ensure their own well-being. While technological bugs and issues are bound to occur, the process of using these types of internet tools are often easier and more intuitive than most expect, and maybe more effective than traditional aid systems.